Hello everyone, thank you all for joining us. My name is Amelia and I'm your co-host for today's webinar on systemic symptoms and gut pathogens. So today we're going to be talking all about what goes on outside of the gut. I am very excited to introduce our guest speaker for this month's seminar, Zoe Kay. Zoe is a qualified nutritionist with over 12 years of experience, and she's got some fascinating case studies for us that she's going to share with us. We will be taking questions throughout the webinar at intervals after each case study because there's so much to unpack. But I have no doubt that you'll find her research super interesting and informative. So without further ado, Zoe, do you want to take it away?
Hello everyone, nice to see you or not see you. So I'm Zoe Kay, I'm a nutritional therapist. I have an MSc Personalised Nutrition and a BSc Nutritional Therapy. I have a fertility specialism, so that's my special interest. I work with a lot of people, therefore, with thyroid imbalances, unexplained infertility, endometriosis. But I also see a lot of people outside of the fertility world and within with gut issues. That's been a recurring theme throughout my career. So please do connect with me. It's great to have a support network in the lonely world of nutrition. So find me on LinkedIn. If you found my information helpful, please endorse me or give me a review. That'd be appreciated. So I'm on LinkedIn. I'm Zoe-K-Nutrition, and my websites are up. So my fertility website is babyrevolution.co.uk. I want to talk to you today about gut pathogens and how they can affect not just the gut but the widespread body, and some of the research that I've found very helpful in allowing me to work out which clients may benefit from stool testing. And to start that, I'd like to introduce you to how microbes are categorized, because that's quite important to understand how you apply your test to your individual patient. So this is the reason why patients need to come to you for the test, and they can't just order it themselves, because you're going to put that into the context, and that's what is so important. And if you understand the fact that there's not just a black and white category about what's good and what's not, then that will help you work out an individualized plan for your patients. And that will lead into the importance of stool testing and why I love it so much and why it's always been a major part of my practice. I'll talk you through 3 of my case studies, and after each one we'll talk through some questions if there are questions, so that we can remember, rather than having to do it right at the end and you can't remember which case study was which. So you'll have a chance to ask questions after each one and then again at the end. I'll share with you some of my protocols that I used with these case studies, and then go on to summarising what the latest research says about some of these pathogens. And then I'll share with you my clinical observations as to how I've seen them generally affect people. So to start off, the categorisation of pathogens and potential pathogens. So when you order a stool test with Genova, they will share with you what category that microbe is found within. And the non-pathogen category, organisms that fall under that category will be assumed to have been part of the normal or commensal flora, and they haven't generally been recognised as being part of any part of disease. However, we are all individuals, so sometimes we still are interested in some of these non-pathogens, because sometimes it's categorized as a non-pathogen because it's only been found at a low level. And so if you find that if it was at a slightly higher level, that microbe would be categorized as a potential pathogen, then you might still, if the patient's got symptoms that you think may be connected and that you have no other data to go by as to what could be contributing to their symptoms, then you may still want to follow a protocol with a let's see what happens kind of approach, so that we're not just being too black and white about these categories. Potential pathogens are considered potential or opportunistic in the right environment, and sometimes they are only considered a problem when they're at a high level. So again, there's even sort of, if you see something pop up as a potential pathogen, you've got a stronger rationale to say that it could be causing symptoms in your patient. And then the pathogen category, they have to be really well recognised as being a main part of pathology and causing symptoms in a very, very high percentage of the cohort. So, you've got some real strong evidence that something needs to be done about the pathogen. So what we take into consideration, we need to look at the research, we need to look at the mechanisms that they can cause problems and apply that to the individual you're looking at and their symptoms and their family history and their emotional health and their stress levels and their genetics, if you know anything about their genetics, and then take that into account when you're looking at whether or not you think the microbe could be having an effect. So why stool testing? I think once clients are generally eating well and you've assessed gut function from a sort of a structural point of view, and you've looked at their general symptoms, taken their case history, family history, and you've sort of supported all of that, so digestion and absorption is working okay, they haven't got any major deficiencies, they're generally eating pretty well. If you've still got some question marks, then stool testing really allows for an in-depth assessment of their gut function. So we can get information about their stomach acid levels, any suggestion of maldigestion, whether their gallbladder's a bit sluggish, whether there's fermentation happening from unfriendly bacteria, which can be very inflammatory and carcinogenic. And we can get a window into their microbiome to see if anything specifically needs targeting in order to restore their gut health. So one of the main things I'm going to talk about today are parasitic infections, and long-term parasitic infections, for example, are really hard to eat your way out of. So you could have, a person eating the most wonderful diet, and of course there is no one perfect diet, but it may be, that you think, oh, you really don't deserve to feel like that based on how you're living. There's something else going on here. Then, this is where the testing is so important, because unless we do something specific to it to address them, it's very difficult for gut health to come back into balance. So, we can really change the lives of our clients, and we can gain that life-changing information from these stool results to allow people to live symptom-free. So the first case study I want to talk to you about, lovely lady, female, aged 44, so mid-40s. She was diagnosed celiac before she came to me, and she was very on board and aware. I have met some celiacs who didn't get much support, didn't really know what they were doing, and didn't realise they were still exposing themselves to gluten. But she was very on it. She was very confident in the kitchen. So she was very much gluten-free, but she was still getting that, she described, gluten feeling, as though she was being exposed to gluten, and the 99% of the time she was certain that she hadn't been exposed. She had unexplained widespread joint pain. She had problems with her hips, lumbar spine, rotator cuffs, the shoulder area, wrists. So really widespread sort of joint inflammation symptoms. She had a very low appetite, just wasn't really fussed by food at any time of the day, particularly, especially first thing in the morning. She'd seen a rheumatologist and she'd seen a physiotherapist, and they hadn't really given her an explanation. So they'd sort of come up with a possible sort of inflammatory syndromes diagnosis, but nothing concrete. And from a structural point of view, the joints themselves seemed fine from a physio point of view. She also had bloating, flatulence, and her bowel movements were very late in the day, so that can sometimes be a sign of gastric stress. If we're going to lose after, it might happen if we had a really late big dinner, but generally if it's consistently happening quite late in the day, then that may suggest that the gut's not happy. She also had mouth ulcers recurring, and rhinitis, so sort of allergic-like symptoms. Her diet, as I said, was pretty good generally. She did have a family history of colon cancer, and her son did have an irritable bowel syndrome diagnosis. Her blood results that she'd had through the GP showed raised CRP, so C-reactive protein, which will be a marker of raised systemic inflammation in the body. So it suggests that there is something significantly stressing her immune system, and that's, that source really needs to be found. Her ferritin was very, very low, and she was taking iron and had been for a very long time. She was also taking a huge range of supplements before she even saw me, about 15 different products, and they were really good quality. She had some really good quality practitioner brands in there, but nothing made any difference. She didn't feel any better. She had gone for sort of a few collagen and sort of generic joint related supplements to try and help. Nothing was making a difference. So my testing rationale was the fact that she was a farmer, so she's actually had an increased exposure to parasitic sources. Although I don't like to blame exposure too much, I feel that it's much more important to look at the vulnerability in the gut as to whether or not parasite or imbalance in the gut occurs, but sometimes exposure is relevant. The fact that she had sort of allergic related symptoms as well as digestive symptoms and unexplained joint symptoms. She was eating well, she had it already, so I couldn't really explain these symptoms. I thought we need this data. Because her appetite was so chronically low, that's often a symptom in infection when the immune system is really active and there's a lot of inflammation going on. So I thought, we need to try and find the source of this inflammation. So that was my rationale. So these were her test results, and I've obviously snapshotted the interesting part. So we found, or Genova found, a parasite called Dentamoeba fragilis. With their amazing DNA technology. So they have two different methods of working out whether someone has a parasite present or not, because generally parasites are quite hard to find in samples. So we really need high quality testing where they run the tests quickly and we get accurate results. Because, a lot of these people have had sort of standard stool results before through other companies or through the NHS and nothing's come back. So we found this Dentamoeba chappie. We've also, and I'll move on to talking about in detail about that parasite, but just to share the rest of her results, some of the bacteriology results also showed some Klebsiella, which can be quite unpleasant. So that's the potential pathogen category because it was at quite a high level. I'm quite interested to avoid Klebsiella getting to a higher level. So even if it's at a low level, I often do something about it. And Klebsiella as well, a lot of the research links Klebsiella to a lower back problems, and they're with the correct gene for AS, it can be a mechanism for encouraging and alkalizing spondylitis symptoms as well. So another potential factor in her sort of joint widespread inflammatory related symptoms, or certainly the lumbar spine symptom. And there was also some bacillus, which the level it was found at was considered non-pathogen, but she wasn't far off being in the potential pathogen category. So, they were the main important factors that we found. So recommendations wise, I recommended, because she was already eating well, we'd got her nutrient levels up, she was strong and in a position to deal with these bugs. It can set people back if we don't get them sort of built up and in a good position to kill off these bugs. If we just go in with a high dose antimicrobial plan, some people can feel really, really unwell. So she was ready to go. And we did it really, really gradually. So I start at a low dose and gradually build up and make sure they're tolerating it okay. There are lots of different products you can use. The general ingredients that have antiparasitic effects are things like oregano, garlic, grapefruit seed, uvarase, berberine, cloves, cinnamon, and I quite like to use time-release versions so that the bugs don't get a break. They're gradually being exposed to these antiparasitic chemicals throughout the 24-hour period. And I really love to use complexes as well, where we get a collection of these herbs in one, because that makes it even harder for the bug to fight back. So her results, she started to feel so much better really quickly. In fact, I've sometimes noticed some people kind of feel a little bit worse and they feel better, and then they feel worse and they feel better. And some people just consistently start to feel better. And luckily she was one of those. And after 6 weeks, all of her joint pain had completely subsided. Appetite had improved, her bowels were way happier, her energy was back, and her strength was back. Her ferritin was also slowly increasing. We did also have to support her ferritin with a slightly better supplement, and we got her mineral levels up as well so she could use her ferritin. But I do feel like the fact we addressed the infection was a massive factor in her ferritin actually being able to increase. She therefore didn't need any steroid injections, painkillers to function anymore, and she was back on the farm working, so she was overjoyed. She was still suffering with a little bit of bloating and wind, so we thought, okay, let's see what we're left with. We're going by symptoms. We haven't retested to see whether anything is different from before. We didn't have any evidence. We've got sort of symptomatic evidence, but nothing on paper. So we ordered the GIFX comprehensive panel, and these were her results after the protocol. So she had a little bit of inflammation still, nothing to be really scared about, but suggestion that there's still something that's not as happy as it could be, and some evidence of dysbiosis there. Main thing on her follow-up results, the parasite was not detected. So the microbial supplement plan worked, killed it off. And I think, we can safely say with how she felt and the results that the Dentamoeba was hugely relevant in her widespread joint pain and gut symptoms and rhinitis symptoms. So her follow-up bacterial results showed that there was still some dysbiosis, some excess yeast hanging around. So that became our target to see whether that would then subside the excess bloating and wind, because we'd really focused more on parasites, because I find that they often have the biggest impact on people's health, and then we kind of moved on to focus more on the bacteria side of things after that. So we use an antimicrobial. A lot of nature's so wonderful in that it does lots of things all at once, and so you'll find antiparasitic herbs will also have antibiotic effects, but sometimes the specific complex you choose or how it's released might change depending on what you're trying to target. So I often use a capsule or a liquid version, something that can release a bit more quickly if we want it to be released higher up the chain in the stomach or the small intestine, because although of course when we're stool testing, we're mostly getting a window into the large intestine. A lot of these bacteria and yeast do like to live in higher up the chain in the small intestine, and cause that sort of upper gastric kind of bloating and discomfort. So things like garlic, oregano, berberine, wormwood, and thyme are excellent antibacterial herbs. And after that protocol, all her bloating and wind subsided. She was enjoying a range of foods. She wasn't having to avoid high histamine foods, which was fantastic. So if we have any questions from this case study before we move on to the next, please feel free to ask.
Yeah, absolutely. So as I mentioned, we are going to just take 1 or 2 questions at this stage, and everything's anonymous, sorry, so don't be shy. We've had one question here. Was there any history of antibiotic low stomach acid, any antimicrobial for a child of 8 years?
So was there any evidence of low stomach acid? Was that?
Yes, yeah.
Yes. So because I often find that when the immune system is significantly challenged and there's a high level of inflammation, which we knew there was from her CRP levels, and there was a sort of an amber on her inflammation results on the stool test, that the body's kind of in fight or flight mode, and that all the energy is going towards fighting the invader, and things like stomach acid production, just like when you're running away from a lion that's chasing you, is not a priority. So we can almost assume that it often is low. And you can see from her results that it's low as well. We've got that evidence, which is so powerful to clients, to put it in front of them and say, look, you can see that you've got undigested foods in your stool, and that there's markers of maldigestion in your results. So yes, we did support her stomach acid nutrient wise, and I do often give people hydrochloric acid or enzymes, depending on how sensitive they are, or apple cider vinegar and things with meals, those kinds of things, to get the stomach acid up. And that's really important to prevent reinfection as well. So yeah, great to bring that up. Thank you.
Fantastic. And we've got just another question here. How long did you continue the protocol for?
So I do a minimum of 6 weeks for parasites, but the risk of getting the levels down or missing a few eggs, and then it all coming back again, and you kind of having all that work undone, I feel isn't worth the risk. So I tend to do 8 weeks, and then retest at that point. But so we did 8 weeks, and then we did 6 weeks when we were targeting the bacteria.
A great question. Another one just here. Did you take her off all of her other supplements, and how long did you run? Oh, that the second half of the question's already been answered. So did you have to take her off all of her other supplements for the treatment?
And I did say, I know I didn't. If she really wanted to continue them, she could, but she wasn't fussed because she was doing all of this and it wasn't working. So I did take her off them, yes, because I didn't really see a rationale in her continuing. I felt like it would be client overload for her to have these new things that I'm recommending on top of what she's got. There were a couple of things that we kind of reused, and got her back onto after, but the priority was, let's deal with the parasite and then the bacteria, and then some generic joint supplements and vitamins and things are brilliant, but I did say, let's stop those, and we'll go in with my protocol for now. Yeah.
Great. Okay. And we actually have quite a lot of questions, so we've probably just got time for one more at this.
Yeah.
And just one more at this stage, and then we'll save the rest for the end of the next Q&A. During the killing phase with the patient, what foods did you have to remove during removing the parasite? Was there any foods that you had to remove from her diet?
Yeah, good question. No, I didn't. There's nothing that I'm aware of that encourages parasites to overgrow from a dietary point of view. You might, there's a stronger link, isn't there, for example, with fungal issues and too much starch and sugar. Anything that does reduce health of the gut, which excess sugars would do, I suppose indirectly could increase the risk of having a weakness to parasites taking hold. But it's a bit more of a tenuous link. So no, I didn't have to restrict her diet at all. The fact she was celiac was already enough of a restriction for her. I did talk to her about general gut irritants and the fact that it would make sense to eat in a way that keeps the pressure off the gut, because going through the anti-parasitic protocol is quite harsh on the tummy. So being careful with alcohol exposure during that time, not overdoing, lots of cakes and biscuits and all of those things. Generally eating well to support yourself through that is very much rationalised. So we kept it simple. Yeah. Hopefully some of the other questions that have come up maybe will be answered anyway, but we'll get another chance for questions right at the end.
Exactly, yeah, there could be another opportunity for these questions still be relevant at this point. So yeah, on to the next case study then, please.
Thank you. So case study 2, another female, a bit older, age 55. She had really painful joints. In fact, you could physically see that her knees were swollen. She was very, very slim. She had rhinitis, so sort of allergic symptoms again. She had symptoms of rheumatoid arthritis, or potential symptoms. So that had been ruled out by the doctor, and they said, no, you don't have RA. She had very red, itchy eyes, and this was, I could see this working with her. She was quite uncomfortable. She looked like she had sort of hay fever, but it was winter. She didn't always have swollen lips, but she had experienced swollen lips in response to some foods, like fish was one of them. She had frequent diarrhea, so most of the time her stools were quite loose. She had unexplained skin rashes, very fatty stools. She experienced symptoms of anxiety without really knowing why. She didn't really have a reason to be worried about anything. She just was experiencing that. She had very poor sleep. She'd wake up in the middle of the night, couldn't go back off to sleep. She's sort of wide awake, and generally had unexplained allergic symptoms. So I worked with her quite a long time ago, actually, and you'll see the difference in her results because the GI effects test wasn't around then. But my first protocol, as I'm sure it would be yours, would be to do an allergy test, because she's got swollen lips and she's got all of these itchy sort of hay fever related rhinitis symptoms. It came back with, and through Genova, so absolutely no food reactions whatsoever. And there's over 100 different foods tested. She hasn't got an allergy to any of them. It doesn't make any sense. She's experiencing swollen lips with some foods. What's going on here? So we had obviously given her a general diet tidy. She was, there was nothing dramatically she was doing wrong generally, but she was really pleased to learn about food and the fact that some of the things she thought were too rich to eat, that you could only eat at Christmas, that she could eat more often, and she was really enjoying feeling kind of liberated from a dietary point of view. So I went on, of course, to do a stool test, because right, well, if it's not foods, it's microbiome. Let's see what's going on here. So the test results look a bit different because these are an older type of test that Genova used to run, but they're exactly the same bugs. So they used to categorize them as sort of many, moderate, or few, so nice and clear. So we got a Blastocystis hominis coming up of many, and we've got the Dentamoeba back again as a moderate level, and we've got a new guy under Limax nana on there as well. So I thought, oh, okay, right, got a few friends hanging around. Let's see what happens. So we did the antimicrobial supplement plan, as I've discussed with you already. So thyme release, oregano, garlic, grapefruit seed, berberine, clove, all of those sorts of things. Or you don't have to use all of those. These are all sort of examples of ingredients. We made sure that sort of vitamin D, vitamin A were sufficient for immune function and her gut mucosal health as well. Gave her digestive enzymes, gave her glutamine for her gut as well, and a methylated multivitamin, just to give her general support through the antimicrobial plan. And afterwards, we moved her on to probiotics. It did take some time. So when the questions came up about, how long did you follow the protocol for? There is no perfect answer, I don't think, about length of time. And I think I've perhaps perfected my plan a bit more over time. But some people, it takes longer. Some people, it's quicker. And what's important is that you go at the speed of your patient. You don't try and rush it and sort of set them back to the point where you then have to stop altogether and take a few weeks off because it's too much for them. So it did take a while. So these are her follow-up results. So you can see that the endolyme max has gone, the dentamide has moved from moderate to few, and the blastocystis has moved from many to moderate. So excellent progress. You know, we think she had had this for sort of 20 years. It's a really long time. So for it to suddenly disappear in a few weeks is probably unrealistic. So we were pleased to see that we were on the right track, and also that helped us show that we needed to carry on. So this is sort of, this would be 8 weeks after her first test. And then we did another 8 weeks, and then we followed up again, and we had the confirmation that no eggs or parasites were found at all. So that was brilliant. Her results were, I mean, she was absolutely over the moon with being able to eat freely. She had no allergic symptoms whatsoever from foods. Her unexplained rheumatoid arthritis symptoms subsided. She was full of energy. Her anxiety went. You know, she was a new woman. So yeah, absolutely amazing results for her. So if there are any questions for this client, then let me know.
Absolutely, and please excuse my pronunciation of this. I'm going to try my best. So how does metronidazole and doxycycline affect the gut, and can they be used at the same time?
So yes, so there are 2 different strains of antibiotic which can be used as antiparasitics. Now, I don't have medical training, so I wouldn't be prescribing antibiotics. Sometimes I like to keep doctors informed of what I'm doing with my patients, and I had one who was under a gastroenterologist, and shared the results with him, with the kind of you might need to prescribe these, or you might want to consider prescribing these for these parasites. But I've because they are considered still, unfortunately, in that non-pathogen or potential pathogen category, it means that unless they are considered a pathogen, which means they have to have caused the same symptoms in over 99% of people, then general medicine doesn't want to know. So and the ones that I've come across don't prescribe antibiotics. If someone can get a prescription for antibiotics, then they can be very effective. However, antibiotic resistance is really, really common. So if they are going to use antibiotics, it's great to use the herbs as well, so that you can overcome some of the antibiotic resistance, but get the power of the antibiotic. You'll find that you're more likely to get unpleasant side effects because you're doing it so much quicker, and you're wiping out so many more of the friendly bacteria on a bigger level than you will be with the herbs. Yeah.
Fantastic, thank you. And then another question here, do you always wait for the symptoms to improve before you retest?
Do I always wait for symptoms? No, because sometimes people won't necessarily notice a difference in their symptoms, but the parasite level has actually reduced. So that's an even stronger reason to test, really, to see where you're at if you haven't got that feedback from their symptoms, because some people won't feel any different from you just reducing the level if it's still there. And even sometimes once it's gone, the immune system is so driven to protect that it will still sometimes carry on those reactions even once the invader's gone, and we have to kind of help it to calm down and know that everything's okay. I think if they can afford it, I would always retest to see progress, and use that data as well as how they're feeling.
Yeah, yeah. And then did you ever find out where the client picked up the microbial infection?
Not the most recent one. No idea where that came from, and I think it was so long ago that she probably wouldn't have remembered. I have worked with a handful of people who we do think we know where it came from, and they are a cohort of people who do things like triathlons and do a lot of open water swimming, because swimming in rivers and lakes is lovely and it's not something that we should stop doing, but it can be a source, as can campsites, because they don't always use mains drinking water. It's borehole where they take it from the ground, and there's a higher risk of parasitic contamination in those sources. But I'd always say that, you know, we've probably all been exposed to these on some level, whether or not they take hold. If our stomach acid is strong, it should kill these things anyway. So let's not be too paranoid about where they came from, but you've got a higher risk if you know someone does open water swimming, or they've done a lot of foreign travel and drunk water from all sorts of different sources. Sometimes you'll find people will say, oh, it's ever since I went to India that I've had this problem. And you think, okay, we need to do a stool test.
Yeah, no, that was a good question. And final one here before we move on to your final case study. How long did the case take to recover?
I work with people for at least 3 months. We were in touch for 3 to 4 months, completely. Yeah. Yeah. So sometimes, you know, quick fixes are overrated, because you really want to get to the root of the problem. It does take time, and explaining that people that, you know, to them in advance can be really helpful. Yeah. And if you think they've lived with it for 10, 20 years, 3, 4 months is nothing.
Yeah, absolutely. And just before we move on as well, because you won't see the full chat here, but someone said your advice is very beneficial and such relief to hear. So that's always lovely.
Oh, thank you. Yeah, that is great. I mean, between us, we can help so many people. So yeah, we are very much needed. So yeah, that's the whole point of this, that we help people. So the third lady, oh, there's a recurring theme here. I don't just work with women. Late 40s, she had an irritable bowel syndrome diagnosis. She had joint pain. Ooh. Elbows and knees specifically. She had bowel movements very late in the day, abdominal cramping, diarrhea, which was mostly exercise induced. So that can kind of speed up how the bowel moves, but it's not really the problem, but it can show up the symptom. She had flatulence, abdominal pain, fatigue, itching. She had really low sex drive. She had poor memory, low mood, low ferritin again, and she was really struggling with perimenopausal symptoms. She ate generally better than average, as I'm sure most of your clients probably do. They've probably done the basics before they decide to invest in your services. Exercise-induced diarrhea, I've already said. And she was very active. She ran triathlons. So her results are similar to the last lady. And I've chosen them because they're so specific to unexplained joint symptoms. But these were her test results. So again, we've got blastocystis detected in many. So a really high level of blastocystis, a small amount of dentamoeba, and a moderate amount of the endolimax. So it's quite common. If you see one parasite, you usually see 2 or 3. They tend to coexist, but sometimes you can just see one. So I think, you know, when you see someone who's struggling with hormonal symptoms, low sex drive, again, it's like that fight or flight. Is reproduction a priority when the immune system is chronically activated? No, it's not. So looking at immune systemic inflammation for that can be really helpful. So we did the general support to get her in a good place to be able to cope with an anti-parasitic protocol. So a really good quality multi, make sure there's enough vitamin D. We looked at general gut irritants and, is she, eating huge amounts of nuts and seeds and whole grains and some of these things that can be really, really healthy, but is she overdosing on those and then going for a run, and that actually, because her gut's really sensitive, that it doesn't cope very well with those. So we just took some of the pressure off, and got her onto good amounts of fruits and vegetables, but make sure that it was within her tolerance. She her symptoms of sort of diarrhea and joint pain all subsided. She was able to go for a run and not have to plan where she'd find a toilet, which was life-changing. She did still have some mood issues, so still some hormonal related symptoms going on there, but that can take more time to settle. And we're not looking at sort of miraculous cures when everything all just miraculously gets better immediately. There will still be some things that we have to work on, but I kind of like to deal with that and then see what's left. So then we ended up focusing more on hormone balance after, but her sort of grain and lectin exposure was really, really high. So lots of beans and pulses and grains, which if the gut's struggling, it can be sensitive to those. So so we looked at reducing her exposure to those and getting her fats and her veg intake up, to help her energy on those long runs. She couldn't afford to retest, so we only went by symptoms, unfortunately. So we don't have follow-up test results, which is a real shame. But as I say, all her joint pain just resolved and her energy was so much better. So again, very suggestive that the parasite was relevant in that. So, bit of a whistle-stop tour of case study 3, but we've got quite a lot of research to get through on these bugs as well. But does anyone want to ask anything about the last lady?
At this point, we don't have any specific questions. I think the rest are best for the end on this one.
Perfect. All right, so little introduction. So I'm just going to talk a bit more about these parasites, specifically what the research says and what I've observed, and then let you all have some lunch. So D. fragilis is sort of controversially symptomatic because we think that it's very much likely to be causing intestinal illness, and it's becoming increasingly recognised, but there's still some uncertainties, and I don't think that there are many certain things in health and medicine, but we still tend to look for them. So if there are still uncertainties, I would still say, okay, but I've got these results and I've got these symptoms, so let's see what happens, rather than waiting for it to become a black and white answer. But generally, it is accepted that D. fragilis is an active infection, although it's not always symptomatic. So do we want to do something about it or not? If you find these parasites and you have no symptoms at all, then you may not want to intervene. I haven't ever found anyone who's not symptomatic, but then I'm probably working with people who come to me because they have issues. So I may have a skewed view of that. But Genova offer the most accurate testing, which as a practitioner, I am hugely grateful for, because it's, one of the reasons that these parasites aren't really widely known about in the UK is because we can't even test for them and we can't find them in a stool sample. So, if we can't find it, why would we want to find out how it affects people, or how can we? So as a practitioner, we can provide clients a solution to this by ordering these tests privately for them. The way that the parasite is transmitted has not been fully defined, but it's one of the hypotheses is that the pinworm infection sort of it piggybacks on with pinworm. I don't know whether I really buy that. It's a possible risk. I haven't ever seen anyone with an active pinworm infection and the parasite. Doesn't mean to say they've not had pinworm earlier in their life, but we don't really know. But as I say, the most important thing is to look at the vulnerability anyway. So some of the most up-to-date research. So in this study, nearly 500 patients with gastroenteritis had stool samples, and 16% of them had blastocystis, and 72% nearly had dentamoeba. So that's a really high percentage of gastro patients who have gastroenteritis, which is usually considered a bacterial infection, that actually, could it be that the parasite's causing their symptom, and then therefore it probably won't be dealt with unless we know the parasite's there. So if you have someone with gastroenteritis who isn't responding, then it could be a rationale to see if they have a parasite. There are some issues with the genotyping of the dentamoeba, so there are different subtypes, and we can't really tell which one is which, and some of them are thought to be benign and some of them are thought to be problematic. So that's where, if you see it, you want to apply it to an individual and not just assume that it's okay or not okay. But in this study, the most common clinical manifestations were intermittent diarrhea, abdominal pain, fatigue, nausea, vomiting, and lack of appetite as well, in association with high levels of eosinophils on blood. So the eosinophils are often raised or sometimes depleted if the infection's been going on for a really long time on a blood result, and that can be that can suggest the risk of parasitic infection. So in this study, about 9% of 864 patients had gastro symptoms with dentamoeba. So not a huge amount in this study, but still a fair amount were experiencing these diarrhea and abdominal pain. Who knows whether they had unexplained joint pain, but they just weren't asked because they were focusing on gastro symptoms? I don't know. So this study about dentamoeba says that patients presented with symptoms of diarrhea, abdominal pain, vomiting, flatulence, dyspepsia, so stomach pain, abdominal distension and itching, and again, presence of high levels of eosinophils. So, we've got some clear evidence that these bugs do cause issues in a significant population. So 29 patients received specific treatment for the parasite, and over 65% of them presented a complete resolution of symptoms. Now, bearing in mind the high level of antibiotic resistance and the fact that they may not have actually managed to get rid of the parasite in all of them, that's a pretty high percentage to suggest that the parasite was causing these symptoms. So what have I observed in clinic? The most common symptoms I see that seem to be associated to dentamoeba is abdominal pain, diarrhea, loss of appetite, fatigue, and nausea. But I also am very suspicious of infection when I see someone who has symptoms of high levels of histamine in the body. So that could be sleep disturbance, hyperactivity, itching, sneezing, hay fever symptoms all round, loose stools, and a low tolerance of high histamine foods and drinks. So for whatever reason, dentamoeba seems to put some sort of pressure on histamine degradation or encourage histamine release. So if you have sort of unexplained histamine-related symptoms, then that may be a further rationale for testing. So we'll look at some of the research for blastocystis now, and a bit of an introduction to Mr. Blasto. Controversially pathogenic, again, because of the different subtypes. So again, we don't always know which subtype that person's got and whether it's one that we know causes problems or one that we know is quite inert. So really need to look at the client's goals and symptoms to take into account the patient's way forward. But sources can be exposure sources from sort of borehole sources, like I mentioned, on campsites, farms as well, open water swimming, but a lot of the time we just don't know. Of course, I have worked with a family recently and several others who I've worked with the children who have gastro symptoms, and they have parasites, and then we end up looking at the parents and they have it too, and it can be transferred across the umbilical cord in the womb, so it can go through families that way. So it can be from birth. So looking at the vulnerability that allows these bugs to take hold, there may be an undiagnosed food sensitivity, gut health may be reduced because of chronic stress or long-term medication side effects, all those kinds of reasons. So for recovery, gut health needs to be focused on to prevent future reinfection and get that stomach acid nice and strong as well. Blastocystis has a really high drug resistance, so it can be really difficult to remove. It's not overly easy with herbs, but it happens. It just can take at least 8 weeks, sometimes longer. So just be patient, and slowly catch your monkey isn't always a bad thing. If we support the body as a whole and get the whole body in a position where it can help fight infection, this can really help the plan be effective. And I've already mentioned about how it's quite common to see parasites coexist, and your parasitic protocol will work for one. If you've got one, you might as well have 3, because all 3 will be killed off as easily as one will be. Perhaps that's why some take longer than others to see how much they have of it or how many there are. But you haven't got to use a different protocol for different parasites. So some of the research on blastocystis. So this was a study done on patients with irritable bowel syndrome diagnosis, and it was found that blastocystis hominis was really highly found in stool samples of IBS patients, but its significance in IBS still needs to be investigated, because IBS is a very generalized sort of diagnosis, and there can be a huge versatility in different experiences and different contributing factors. But nearly half of the patients, these IBS patients, had blastocystis. So that's quite a significant amount, to think that all those people out there who think they just have to sort of put up with IBS and that's just how things are, there could be a real clear explanation. So another study about blasto in this cohort of primary school aged children. There are nearly sort of 30% of the children had blasto in this study, and the most common symptoms that they were experiencing were abdominal pain, lack of appetite, and nausea. There is quite a difficulty with being able to see blastocystis in samples, and I think Genova get around that with the 2 different ways that they measure really nicely. But of course, we don't know exactly the quality standards that they were using on all of these studies, so it could have actually been found in a much higher rate. But we know that at least 30% of these children had the blasto, and they were experiencing these symptoms. So there are some issues with diagnosis. Generally, we don't have to worry about that if we're using Genova's test. So there's different subtypes of blasto have been reported in both healthy and symptomatic individuals. So we have to be quite individualized with our approach to know whether or not it could be causing a problem in someone or not. So don't get too excited and make promises. Always be cautious and say, well, there is some strong suggestion that this could be relevant in your symptoms, but we won't know until we try and go down that route. And then they'll always be pleasantly surprised if their improvements are better than you suggested they would be. So this is really, really interesting, that blasto is quite strongly linked with food hypersensitivities and spontaneous urticaria, so allergic red rashes, basically. So the presence of food hypersensitivity reactions was significantly higher in the blastocystis detected group, and it's seen as a significant risk factor. So if you are working with someone who has a very, very restricted diet, reacts to lots of different types of foods, or perhaps like my first case study, who felt like she was being exposed to gluten and she knew she wasn't, and she knew she shouldn't be having gluten because she was celiac, what's causing that mimicking of symptom? Could it be a parasitic infection? And if that is dealt with and the immune system gets a bit of a day off, it might not be so hyperreactive to lots of other foods, because what we want for our clients is to be able to enjoy their diets and to be able to eat in a way that that they enjoy and not have to have excessively restrictive diets. So it's possible that food reactions can improve once blasto is dealt with. So this study talks about allergic skin rashes and parasites. So 21 of the patients in this study had parasites, and they had urticaria. Blastocystis was the most common parasite that was detected, and after antiparasitic medication, the urticaria only continued in a really tiny amount of patients. So, I think it was 15 of the patients. So that had complete improvement in their symptoms. So that suggests that it can cause that spontaneity of allergic symptoms, and my case studies suggest that was the case as well. And I've got plenty of other ones I could talk about as well. So what have I observed in clinic? Blastocystis, I usually connect with unexplained arthritic-like symptoms. So it's not impossible that someone may already have a diagnosis of something like rheumatoid arthritis, but usually I see people with those kinds of symptoms, but not really any kind of diagnosis. No one can really explain the inflammation in the joints. It can also contribute to inflammation in the large bowel as well. And I have seen patients with inflammatory bowel disease go into remission once the parasite has been removed. So it can be more localized as well. I've seen about 30 patients with arthritic-like symptoms, and most of them have gastro symptoms as well. And I've had some with sort of tendinitis type symptoms, but and they might have a diagnosis, but mostly they have unknown causes for their joint issues. The reason for that mechanism, how is it affecting the joints? How is it affecting allergic reactions? We don't really know. There's some suggestion that that fragments of the parasite can end up in the joints, and then the immune system reacts to them there. But we do know that GI inflammation puts a huge amount of strain on the immune system, and that inflammation can stem from the gut and go across the whole body. So that's enough of an explanation as to how, for me, that something causing significant inflammation in the bowel may then affect the joints, mood, hormone balance, thyroid health, and all these other things as well. Most of my patients who had this parasite also had raised CRP levels on their blood, so that's a real black and white evidence that they had systemic inflammation. And so some of the symptoms that I often observe: mouth ulcers and pain, maybe IBS or IBD even, rashes, nausea, low appetite, abdominal pain, bloating, flatulence, acute or chronic diarrhea. And so some of these full papers I've got from the Royal Society of Medicine online library. If you're a member, you get access to lots of full text papers. If you want to read any of those full papers that I've mentioned, then you can go there. You'll find some of them free as well on the internet potentially as well. So let's move on to any questions.
Absolutely, and we've hit an hour on the dot, so perfect timing. If anyone is short for time as well, just remember everything is recorded, and we will send you a full recording of the full session. So don't worry at all if you're kind of reaching your limit here. But we're going to go and head into some questions. We've got quite a few. So someone has asked, your case study, for your first case study, Zoe, were they able to then eat gluten after they were finished with the protocol?
I have not, they haven't tried, they haven't had an exposure that they're aware of. So she had, she was diagnosed celiac, So it would be very controversial for me to say, oh, actually, you could try gluten now, and it might not, because of the huge implication that could have on her body. You know, the theory is that if we have a true allergy, like an IgA response or a celiac diagnosis, that is for life, and there is nothing you can do about that. So it would be very controversial for me to say, well, I think you could try eating gluten. I'm sure she'll have an exposure accidentally at some stage, and it will be interesting to know whether she felt okay. But and I would only get people back to eating a wide range of foods if they didn't have an allergy. So like case study 2, her allergy results were completely clear. So we had no kind of reason why she shouldn't be able to reintroduce those foods. And my other client that has a very limited diet, you will find that there's not many things they can eat, but only 1 or 2 things they know they really have a problem with. So a lot of those things that they can then start to reintroduce safely. But if they have a diagnosed allergy or celiac disease, we can't really recommend that they start reintroducing those foods.
Yeah. And then I think another question that came in during case study 1, but I think it's still relevant across. Did you follow up with probiotic therapy to help mitigate the long-term effects of the antimicrobials?
Definitely, yeah. I do move on to probiotics after, yes. And sometimes, well, obviously, a nice wide range of fibers to feed those bugs. I think probiotics are great whilst you're taking them and they're passing through the gut, but for longer term gut health, we need to make sure there's enough food there for them. So yeah, a nice variety of different fruits and vegetables, and maybe even a fiber-based supplements to optimize the friendly bacteria. Yeah.
And then following on from that, what would your go-to probiotic supplement be for recovering the good gut bacteria in case of any following herbal protocol?
I really like BioCare supplements. I'm a big fan of BioCare. I think that I would say that in the short term, probiotics are fantastic. I really like to use fiber supplements as well because it's so hard to get optimal microbial diversity of friendly bacteria, even on a really healthy diet. So being able to sort of boost the amount of food that the friendly bacteria have, I feel is the most powerful way that will actually end up with a good level of friendly bacteria wanting to live in the gut, as long as there aren't nasty things hanging around anymore. If they've got enough food, then they should want to hang out there. Whereas I think the probiotics sometimes are great to calm things down as they're passing through and have a soothing effect on the immune system. We don't think that the probiotics really themselves start to live in the gut and populate. It's more as they're going through. So we've really got to work on the feeding what is populating and actually growing from our soil as such.
Great. And then we've had another question here. Can you recommend any specific antimicrobials that are safe for use with children? In this case, I think he's got an 8-year-old with defrag already supporting digestion and stomach acid, etc., but would like to use antimicrobials if possible.
Yeah, so it's really tricky because they taste really bitter and the capsules are massive. I have used liquid versions of oregano before in children, and you have to sort of like mix into a bit of honey, and some children will be no way taking that. This one, he was brilliant and got on with it. Sometimes you can, if you get the tableted forms, you can snap them in half, and some children from quite a young age will be quite happy to take that. Otherwise, Biocare do a liquid grapefruit seed extract, which does have some parasitic effects. It's more geared towards antifungal, but it will have some antiparasitic. And it tastes quite citrusy. It's quite pleasant. So that mixed into a little bit of milk or a little bit of honey or something to take the edge off. Most children would tolerate that. So that would be probably my go-to for children. And just be really careful with dose and being careful to go slowly and build up.
Great, thank you. And then a question that came in when you were discussing symptoms with allergies. What allergy symptoms are very common in parasitic infection? Is the immune system triggered, finding irritants in other places as well?
So there could be two sort of mechanisms, probably more, but the two main mechanisms that I can think of would be that the immune system's chronically stressed. It's trying to react and respond to an invader. So it's already in kind of a bad mood. So it's going to be more inclined to make mistakes and to misjudge foods as threats. There's also some suggestion that there's some molecular mimicry. So the components of some of the parasites and other microbes look structurally similar to parts of foods. So if you're sensitive to one, you can be sensitive to the other, and you start to react to the food because the body almost thinks it's the parasite and it's confused. So that can be a mechanism. And the type of symptoms you see, it could be it could be kind of typical immune activation symptoms, low energy, grumpy, maybe anxious, tired, poor sleep. Or it could be obvious allergic symptoms of itching, rashes, sneezing, rhinitis, sinusitis, those kinds of things.
Great, thank you very much. And then just another question, what sort of symptoms should we kind of look out for when people are taking antimicrobials that may suggest that it's a good thing to stop taking them?
Good question. So whatever symptom the bug was causing sometimes can worsen when we kill them off because they have a life cycle. So you'll see people describe, oh, my symptoms get worse like every 6 weeks or every couple of weeks it flares up and I don't really know why. And it's probably connected to the life cycle of these bugs because when they die off, they release a lot of the irritating chemicals that they release every day when they are eating because they're living bugs like we are, but they release more of them when they die off, so they can cause more symptoms then. So you often see kind of waves. So when they start taking an antimicrobial, obviously would kill things off quite quickly, and there's a big die off initially, and then each sort of wave tends to get a bit easier. So it could, in the short term, worsen whatever symptoms the bug was potentially contributing to. So they might feel headachy, more tired. They might have a flare up of skin problems if it was contributing to their skin. They may feel more grumpy. Nothing sort of life threatening, but it's if people are aware that it's normal and that we need to go at a sensible pace that's not pushing them too far, then they don't panic when this happens. And that's why it's so important to stay in regular contact and get feedback from how people are feeling rather than sort of giving them a program for 8 weeks and then not speaking to them again because you don't know how they're feeling. And if they're feeling horrendous and they carry on, then it might be sensible just to stop for a week. So keeping in contact with your clients is really helpful.
Yeah, that's great because I think that kind of answers a few questions we had around changing course of action, retesting, things like that. So that's really helpful. There is a question here. Did you specifically do anything for reducing histamine or where the histamine symptoms improve by removing the bad bacteria?
No, nothing specific. No, I think I'm quite I feel quite passionately about not restricting diets unless we really have to. There are, of course, reasons why we really need to, and it's very powerful reasons. But a generalized antihistamine diet is very limiting, and it often reduces a lot of fiber intake. It's a bit like the low FODMAP diet. It's a bit of a plaster. It doesn't really solve the issue. Why are those foods not being tolerated? What's going on? And it one of the reasons could be a parasitic infection. So no, I didn't put her on a low histamine diet. I mean, I would have given her some zinc for stomach acid, so that can help you degrade histamine a bit better, but that alone wouldn't have been enough to improve those symptoms. So no, I do believe it was removing the parasite, and I've seen it quite a few times. People have unexplained histamine-related symptoms and this parasite, so I feel quite confident in the connection. But it won't be the reason for everybody, of course.
Yeah, and then we'll just do one or two more questions as we're coming to a time here. So, do you think there's any useful parasites?
Are there any useful parasites?
Yes.
I don't believe that there is anything really in nature that doesn't have a role. So there are some definite positives to sometimes having had these parasites, yes. And one of them is that it's a bit of an oversimplification, but it's a bit of a giving the immune system something to do. We have an immune system for a reason, and we need to sometimes use it. And we're a bit kind of bubble wrapped. We don't go outside enough. We don't get injured enough. We wash too much. We don't get scratched by nettles. We don't allow the kids to dig in the mud. All of those things means that our immune system doesn't get to do a lot of the time. So actually giving it something to do can be really, really powerful, and actually sometimes prevent being oversensitive to things like foods. So in some people, I see that there are no real direct food reactions. There may be that they eat foods and feel rubbish, but it's not actually anything to do with that food being that they're being allergic to. So I actually think that if we've had these parasites, actually in the longer term, it probably reduces risk of us having food sensitivities. Yeah. But it depends, if it's a long-term infection that's really draining people and it's causing them significant symptoms, then it needs dealing with. But having been through that isn't necessarily a bad thing for our health. Yeah. And there will be, of course, people who have these parasites and don't have any symptoms, and you may choose not to do anything, and it may be quite a healthy thing for them because maybe of the subtype that they've got is fine.
Yeah, and then we'll just take one last question at this point. If a patient has constipation rather than something like diarrhea, does that rule out the case of bladder in your opinion?
Not necessarily, because it depends on what else is there. So, for example, excess yeast can be a contributor to constipation. So if they have both, then sometimes it can do a weird kind of counteracting. Actually, it could give them completely normal stools if they've got a parasite and a fungal problem, because it could kind of even it out. So no, I would never assume anything, but sometimes you can be surprised by the results, and it's not quite what you were expecting. But yeah, look at the whole. I wouldn't sort of choose one symptom and then test based on that. I'd look at the whole picture as much as possible. But certainly not everyone will be experiencing diarrhea when they have these symptoms. It's a good point to mention.
Oh, that's great. Thank you so much, Zoe. You've been fantastic. Thank you very, very much. And I think it's really beneficial for everyone to hear those real world scenarios as well. We hope you all enjoyed. Yeah, we hope you've all enjoyed the webinar this month, and everyone will be receiving a full recording of the session along with a post-event survey that we'd really appreciate you taking. If you've got any additional questions for Genova or for Zoe, you can drop them at infouk@gdx.net and we'll try and get round to those for you at the end of the session. We look forward to seeing you at our next webinar. And with that, thank you very much, Zoe. We hope you have a really enjoyable rest of the day.
Thank you, everyone.
Thank you very much. Bye.